Alright, unfortunately, this will be the final part in our Noir series television show. It got cancelled. Anyway, here's the last episode. I hope you enjoy it. It'll take place in the local watering hole, Gonzo's nightclub. And the scene is titled The Violinist's Last Clap, and it's going to be covering Neisseria gonorrhoeae. Okay, let's start drawing out Gonzo's bar. The name Gonzo should remind you of gonorrhea. Now we'll add Mac, and he'll be flirting with a woman at the bar. And Mac will remind you of all of the common features amongst the Neisseria species, but I'm not going to go over all of those again. However, you should notice that he is flirting with somebody at the bar, and this sexual tension he's creating as he's flirting should remind you that gonorrhea is a sexually transmitted infection, although it's probably not necessary to remind you of that. Okay, so let's go through some of the microbiology features of gonorrhea, some of the trickier stuff to remember. So first, it's described as being a gram-negative diplococci, and it's facultative intracellular. The cells they like to invade are polymorphonuclear lymphocytes, or PMNs. So we actually have a great way to illustrate this. We'll add some seating for the restaurant, and check out these trendy, high-back, white chairs, each of which has 2 red pillows on it. These 2 circular red pillows represent the gram-negative diplococci, and they're resting inside the white chairs that are large and curved to look like a white cell. We've also added these subtle reflections on the back of the chairs to look like nuclei. So specifically, these chairs are supposed to look like PMNs. So Neisseria gonorrhoeae is facultative intracellular in PMNs. Unlike meningitis, Neisseria gonorrhoeae is not encapsulated. Since this is an important difference, we'll highlight it in this drawing by having a glass falling off the table and breaking. This broken glass capsule should help you remember that gonorrhoeae does not have a capsule. Okay, so now let's move on to cover the clinical features of gonorrhea. Neisseria is an STI, and as such, the first place it most commonly affects is the genitalia of both men and women. In men, this would present as a urethritis that can then travel up the tract to cause prostatitis and orchitis. And as far as male GU infection goes, that's basically it. So that's fairly simple. For women, it's slightly more complicated, and it's going to be what we focus on in our story. When the infection ascends in women, it can cause pelvic inflammatory disease, or PID. This is important because PID can cause scarring that can lead to infertility or ectopic pregnancies. So we'll represent PID by drawing this chandelier. Now, how does this chandelier represent PID? Well, first of all, notice its shape. It has a nice, large, round center, flanked by 2 arms extending out with curled ends. We've made it look like a uterus with fallopian tubes and ovaries. And these candles on the chandelier represent inflammation. So altogether, that's PID. Now, as the candles burn throughout the night, they begin to drip hot wax on the table below. This hot wax is how we're going to represent the white, purulent discharge that's characteristic for gonorrhea. This discharge can occur in both men and women, and generally, the discharge from gonorrhea is thicker and more purulent in appearance than the discharge from chlamydia, which tends to be more thin and watery. We think making it analogous to hot wax could be a really great way to remember it because wax is a thicker and warm substance. So that should really make you think of thick and purulent discharge. A further complication with PID is that it can spread into the peritoneum, and when this happens, it's referred to as Fitzhugh-Curtis syndrome. The infection of the peritoneum can lead to adhesions that form to the capsule of the liver, and these long and thin adhesions are referred to as violin string adhesions. So to help you out with this, we'll add the Fitzhugh-Curtis band, which is a trio of jazz musicians playing some string instruments. But we only have 2 here. Our violinist is missing. Which brings us to the plot of this scene. Our violinist got crushed to death under this statue. And here's a violin sitting up front to help you remember the buzzword violin string adhesions. And the Fitzhugh-Curtis band will help you out with the name of this syndrome. Doesn't Fitzhugh-Curtis just totally sound like a jazz trio? Probably is. So as the statue fell, it broke at one of its weakest points, the knee. So we'll add some cracks on the knee, and this is because gonorrhea can cause polyarthritis, And in question stems, most commonly you'll see it affects the knee and is often asymmetric, which is why we have cracks only on one knee as opposed to both. So if you have a young, sexually active male or female that shows up with asymmetric arthritis, definitely keep Neisseria gonorrhoeae near the top of your list. A joint tap will show purulent synovial fluid that doesn't gram stain, and that's because the infection is intracellular. Now we'll talk about an important congenital infection with gonorrhoeae. If an expecting mother has an untreated gonococcal infection, she can pass the infection on to the baby during delivery. This can manifest as a purulent conjunctivitis that generally occurs within the first 5 days of life. Chlamydia, which can also cause neonatal conjunctivitis, is usually somewhat delayed, and on tests, you'll usually see it begin at least a week after birth. So to remember that Neisseria gonorrhoeae can be passed to the baby and cause conjunctivitis, we'll add this mother holding a baby and shielding the baby's eyes from this gruesome scene that just unfolded. And this is to remind you of conjunctivitis. And you can also remember that the mother is really quickly shielding the baby's eyes as soon as possible. And this is to remind you that gonococcal conjunctivitis generally has a shorter time course to onset. So the treatment of choice for gonorrhea is ceftriaxone. So we'll give our statue 3 axes, a recurring symbol for ceftriaxone. We'll also add this 3-axe emblem to the signs on the wall. Although ceftriaxone is all you need to successfully treat gonorrhea infection, if a question asks you what you give to someone with a gonorrhea infection and you select just ceftriaxone, you'd get the answer wrong. But this is because in someone with gonorrhea, their chances of having a co-infection with chlamydia are very high. So when you start them on treatment, you assume that they have a co-infection and treat for chlamydia as well. And this goes for treating neonatal conjunctivitis as well. You'll see in our chlamydia video that chlamydia is treated with either a macrolide like azithromycin or doxycycline. So we're going to add some napkins to this table that are folded up in a decorative shape that makes them look like clamshells. These clams are to remind you of chlamydial co-infection. And that's all we have for gonorrhea. And it's also the conclusion of our Noir series, a short-lived but memorable TV series that almost definitely would have won an Emmy.